Good evening and welcome. My name is Pat Daly, the Director of Education with the Halton Catholic District School Board. Thanks for joining our webinar tonight. As we always do here in Halton Catholic, I'd like to start the evening in prayer, and in particular, I'd like to keep the health and safety of all of the community members in our prayers tonight, and in particular offer a prayer for a safe return to school in September. Lord, circle our schools and keep these good things within. Eagerness to learn, warmth of friendship, respect for all, service of others, reverence for life, fitness of body, mind, and spirit. We ask these through our Lord Jesus Christ. Amen. In the name of the Father, the Son, the Holy Spirit. Amen. We're really excited tonight and very grateful to welcome Dr. Hamidah Meghani to our webinar. Dr. Meghani is the Commissioner and Medical Officer of Health for Halton Region. Dr. Meghani is passionate about public health and is deeply committed to keeping our children safe and working with partners such as our board to create an environment that fosters good health. We're very thankful for the support that Dr. Meghani and her team have provided to our board over the past several months. Thank you and welcome, Dr. Meghani.
Well, thank you so much for that very kind introduction, Pat, and good evening, everyone. So firstly, thank you for giving up your time this evening to tune in to the Board of Education webinar about a safe and healthy return to school. Heading back to the classroom has always come with mixed emotions. We regret the passing of the summer, but look forward to the resumption of school year routines. This year, our routines will look very different, and because of COVID-19, many of you, teachers, staff, parents, and students, are likely feeling more anxious than usual. Let me say up front that public health is here for you, and we are working together with Halton Catholic District School Board to support our schools as they prepare to reopen. We've been working together with the board at every step of the way through this planning process, and we're confident that we'll be able to provide a safe and productive learning environment for students and staff. I understand very well that this is a really difficult time for everyone. Students have been out of school since March. As parents, it feels as if you are facing an impossible choice. Do you pursue remote education for your child? This option makes it more challenging for children to socialize with their peers, and you may be working from home, which in itself adds complications. Do you have your child return to school buildings at a time when there's talk of a second wave of COVID-19? Unfortunately, there really isn't a right choice, only a choice that will work best for your family. Let's be clear, to reach their full potential, our children need the learning and socializing that in-school education provides. Attending classes is good for their education, good for their overall well-being, and good for the whole family. After months of isolation, where possible, our children need to be with their friends. They need to be able to play, learn, and socialize in as safe an environment as possible. That said, as we open up more opportunities for people to gather in the community in places such as schools, we will certainly see more cases of COVID-19. It is simply not possible to prevent all cases of this virus. What we can do is work together to try to contain cases and outbreaks and minimize the most severe outcomes. Everyone's situation is different, and the decision to send your kids to school in person needs to be one that works for you and for your family. You need to think about your child's specific needs, and you need to think about the people who live with you and your child, as well as this level of spread in our community. So let's start with your child's needs. Does your child have special learning needs that require in-class supports? Or does your child have any medical conditions that may make them prone to severe disease if they get COVID-19? Kids who already have underlying medical conditions such as lung diseases like cystic fibrosis or cancer that may reduce their immune system's ability to function well, or diabetes that is not well controlled, may be more at risk. Talk with your child's doctor to discuss the risks. In some cases, staying at home may be the safer option, but we think that for the majority of children, the benefits of being in school will outweigh the risks. While we're still learning a lot about COVID-19 on a day-by-day basis, what we do know so far is that children infected with the virus experience mild symptoms. Common symptoms of COVID-19 among children include fever, cough, runny nose, sore throat, headache, body ache, and diarrhea, and many children will have mild or no symptoms at all. Additionally, children account for a very small number of COVID-19 cases overall. So by August 23rd, this is our latest data, 6% of all confirmed cases in Ontario of COVID-19 were aged 0 to 19. This is compared to 21% of the population falling into this age category. Severe outcomes, including hospitalizations, ICU admissions, deaths, and other complications, have been rarer among cases in children compared to adult cases. For example, as of August 23rd, only one of the 27,998 deaths reported to date for Ontarians were among cases aged 0 to 19. Similarly, by August 23rd, there had been 60 confirmed COVID-19 cases in Halton who were between the ages of 0 and 19, accounting for 7% of all of Halton's cases, whereas children aged 0 to 19 are estimated to make up basically a quarter of Halton's population. If probable cases are included, the proportion of Halton cases aged 0 to 19 rises a little bit to 10%. However, this is still substantially lower than the population proportion. There have been no deaths among COVID-19 cases in that age range in Halton. Next, let's think about the people with whom you live. Most people with COVID-19 infection will develop mild symptoms and will recover on their own at home. However, the risk of severe illness and outcomes is higher for those who are above the age of 70 or who have chronic diseases like diabetes, high blood pressure, heart disease, or cancer. If you or a family member are medically fragile, you will again need to weigh the benefits and risks. And here again, it's important that you consult with your healthcare provider to help you make an informed decision. There are ways to lower the risk, such as keeping sick children away from the at-risk person in your home and making sure that they are not exposed to other social networks or social circles that could expose them to the disease. I should also add that overall, the evidence to date suggests that children are not significant transmitters of COVID-19, but here again, we are still learning. So the bottom line is that decisions around heading back to school will be different for every family depending on your child's academic needs, whether your child or household members are at increased risk for severe illness, and your family's own unique situation. Consider also the level of community spread in your area. The most frequently reported way that children in Ontario have been infected has been through close contact with another person who has a confirmed case of COVID-19, usually within their household. So for our part in public health, we provide guidance in line with the provincial plan around implementing appropriate infection prevention and control measures and have posted guidance documents on our website. As I mentioned earlier, we're working with the school board to ensure that important measures are in place to protect our students, including active daily screening, no mixing of cohorts or classes in the elementary years, ensuring children understand how to properly wear face coverings or masks if required, and enhanced hand hygiene and cleaning. It will also be important that staff wear personal protective equipment such as masks and eye protection. Note that public health does not provide this equipment. It will be provided through the Ministry of Education. Additionally, we provide support with the development of safe school reopening plans. We don't approve the plans at the local level, but we do provide lots of guidance. This includes providing recommendations and resources to help school boards and private schools develop policies and procedures to ensure the health and safety of staff, students, parents, guardians, and visitors. We support training and educational opportunities for school staff regarding infection prevention and control practice. We help develop processes and protocols for managing sick students and staff at the school. We also are helping develop guidance around managing a confirmed case and an outbreak at a school. And we are trying to ensure that schools have child-friendly resources that support healthy behaviors in the school setting. You may recall that earlier this summer, the provincial government announced that it will spend $50 million to fund 500 additional school nurses to provide rapid response support to schools and boards in facilitating preventive measures, including screening, testing, tracing, and mitigation strategies. So this is for Ontario as a province. In Halton, we are waiting to receive the finalized terms and conditions on this new funding. In the meantime, we have already dedicated many resources towards supporting schools reopening. And we will increase our public health nurse staffing in the coming weeks to provide even more support as schools begin to reopen. So let me take a moment to provide some clarification on what our school health nurses will be doing. The expected roles for these public health nurses is to support the safe reopening of schools, including supporting existing school health and communicable disease control programs in public health. Our nurses are already involved in the development and implementation of COVID-19 health and safety plans. We have also provided information on infection prevention and control measures to school administrators, and our infection prevention and control team will be supporting the schools through support visits, which will begin by mid-fall. Surveillance of absenteeism and specific to COVID-19 is being planned for in collaboration with our epidemiologists here at Halton Region Public Health. Screening of students will be done by parents at home with some active screening at school. Through the first wave of COVID-19, our nurses have become experts in case and contact management and outbreak management. We have worked with a variety of settings, such as long-term care homes, retirement homes, group homes, childcare centers, all of which have been operational throughout the pandemic. We have prevented many outbreaks by helping these settings put into place many public health measures before even a single case was detected in those settings. Using this expertise and the guidance from the Ministry of Health, we will do the same for schools. Both myself and my Associate Medical Officer of Health, Dr. Deepika Lobo, are always involved in outbreak management and provide guidance and direction to our public health nurses and to school staff. Our nurses will also support communication and engagement with parents and local communities, as well as primary care through the COVID-19 call center at Halton Region, which is available during business hours and may be available after hours should there be a second wave of COVID or a surge. I want to take a moment now to discuss testing for COVID-19, as this can be a confusing topic. In Halton, testing is not done through local public health. However, should there be a case or outbreak of COVID-19 in a school setting, public health will make decisions about who needs to get tested and communicate to affected families and staff. Testing is available in Halton through our hospital-based assessment centers. Contact information for these centers is available on halton.ca/COVID-19. Assessment centers in Halton require a booked appointment. All symptomatic individuals and contacts are seen either the same day or within 24 hours. Some primary care physicians are also offering testing in their clinics. One more note about testing. You and your children do not need to get tested prior to the school year commencing, unless, of course, you have symptoms of COVID-19 or have been informed that you are a close contact of a confirmed case of COVID-19. There may have been some mixed messaging on this subject in other parts of the province, and I just want to take a moment to reassure you that this is not required here in Halton. While Halton continues to have a low number of COVID-19 cases, returning safely to school is a community-wide effort, and we all have a role to play to help keep our numbers low. This means we're counting on you and counting on all of your neighbors to tighten up social circles as much as possible, practice good physical distancing, follow good hand hygiene and respiratory etiquette, wear face coverings in indoor public places, and when physical distancing can't be maintained, get tested if you or someone you know has symptoms of COVID-19, and stay home when you're ill, even if you have very mild symptoms. I really hope as a group of teachers, staff in school settings, and parents, you will be our ambassadors and take on this messaging to those that are not in the school setting as well. Along with these steps, knowing what to do if you've been exposed to COVID-19 is another key way to protect yourself and your community. One way to know if you've been exposed and the steps you need to take is to download the federal government's free COVID Alert app from the Google or Apple Store. The app does not collect, store, or access any personal data or health information and is completely voluntary. You can choose to download, use, or delete it, but the more people who use it across the country, the more effective it will be in helping to protect each other and our communities. So one of the best pieces of advice I can offer is to stay informed about both your school's plans and current public health advice. If your children will be learning remotely, talk to them about how the school year will be different and look for opportunities for them to socialize and be physically active. If your children will be going back into the classroom, talk to them about the importance of keeping themselves, their classmates, their teachers, and school staff safe. In either case, encourage them to talk to you about their concerns and ask any questions that they may have. Here are a few other tips you can also consider. Remind your child how to properly wash their hands and give them hand sanitizer to practice. You can also remind your children how important it is that they not touch their faces or their friends' faces. We know this happens in the younger age groups. Explain to younger children that they should not put objects into their mouths. Remind children about the importance of not sharing food or personal items, such as toys, and for older children, cell phones. Explain what physical distancing really means. For younger children, encourage them to spread their wings when standing in line with one arm in front and one arm behind to keep 2 meters between everyone. You can encourage children to greet each other using non-physical gestures, for example, a wave, a nod, or a verbal hello. With younger children, you can also practice following directional signs. Visit a place where there already exists some directional signage, such as the mall, and point the signage out to them. Or use chalk drawings on the driveway to show what floor decals may look like. Try to make sure that your children are up to date with all recommended vaccines, including the vaccine for influenza when it is available this fall. School boards must follow minimum requirements set out by the Board of Education and by the Ministry of Education related to masks and face coverings, but each board also has decision-making authority to exceed these minimum provincial requirements. What will be especially important will be to ensure that children understand how to wear them properly. They need to wear masks that fit well around the nose, mouth, and chin without gaps at the sides. Clean their hands before putting on, taking off, or adjusting their masks, and avoid touching their masks while wearing them so that they don't contaminate their hands. Wearing a mask correctly for a full school day will be particularly difficult for young children, and children with underlying medical, developmental, and mental health conditions. It'll be very important for schools to plan for mask breaks with appropriate physical distancing, of course, during the school day, and to help children learn and practice regular hand washing and good mask behaviors. We will support all schools in developing age-appropriate mask education for students. You can refer to the video linked on the slide for more information. And finally, encourage children to ask questions, express concerns, and remind them how important it is to be kind to each other once they are back in the classroom. For students of all ages, it will be important to support not only their physical health, but also their mental health. As I said up front, it will not be possible to prevent all cases of COVID-19, but we need to work together to try to prevent and contain outbreaks. Further guidance from the Ministry of Health is expected shortly for both public health units and for school administrators related to processes for dealing with positive case in a school, and we will provide updates once we know more. For now, in the event that a student develops signs or symptoms of COVID-19 at school, our guidance advises a staff member to immediately separate the students from others. A staff member should then supervise the student in a designated room or space, which they should disinfect once the student leaves. The student's parent or guardian should be contacted to pick up the student immediately. Students with symptoms and their siblings must be picked up and taken home. Students with symptoms must self-isolate at home and be referred for testing. Household members, including siblings, must also self-isolate at home in this time period. To return to school, they will need to self-isolate for 14 days, be medically assessed and cleared by a physician to return to school, or show a negative test result. If test results are negative, the student may return to school after being symptom-free for 24 hours. If a student or staff member tests positive for COVID-19, Halton Region Public Health will notify the individual and the school and provide further information on contact tracing and outbreak management, and we will endeavor to maintain confidentiality. Anyone who has a confirmed positive result must have clearance from public health in order to return to school. So generally, an outbreak means there are 2 confirmed cases in a particular setting that are linked somehow. Based on our initial assessment, should there be 2 cases in a school, public health may declare an outbreak if we feel that those 2 cases are in fact linked. If an outbreak is declared at a school, public health will investigate to see whether others at the school are impacted, define the outbreak area, and identify any others who will need to be contacted, isolated, and tested. We will send the school an outbreak declaration letter and continue daily contact with the school until the outbreak is declared over. Schools are responsible for keeping staff, students, and families informed. As I mentioned before, we will also provide guidance and direction on who needs to get tested or should be considered for testing. We will also provide education we will also provide direction on who needs to be self-isolated versus those that can continue attending school and monitor for symptoms. Monitoring for signs and symptoms of COVID-19 will always be required by all families and staff, regardless of whether a case of COVID-19 has been identified at the school. So in conclusion, there is no risk-free option. Sending your child to school may increase the risk of getting COVID-19. On the other hand, keeping your children at home may increase the risk of interrupting their social, emotional, and developmental well-being. As I said up front, there is no right decision, only what's right for you, for your child, your family. We all need to continue to work together to help our children learn safely. By vigilantly following public health measures, staying informed, and keeping your children home when they are ill, you will be helping to limit the spread of COVID-19 in our schools. Halton Region Public Health offers resources for parents including mental health resources and guidance from the Hospital for Sick Children on our website at halton.ca/COVID-19. And you can subscribe to Halton Parents' social media channels for more information at halton.ca/haltonparents. So I hope that I've been able to answer the majority of your questions, but now we'll take a few minutes to respond to a few more questions that have come into your school board.
Thanks very much for that, Dr. Meghani. In fact, you did answer many of the questions that parents and staff have sent in. But if it's okay with you, I wouldn't mind asking you to maybe go into them in a little bit more detail. And these are the more common questions that we've received over the last several weeks. So the first one does have to do with the use of non-medical masks in schools. We know both the Ministry of Ed and Public Health encourage the use of masks in schools, understanding that it's one of the measures we can put in place to protect our students and staff. Can you comment on the importance of wearing masks, especially where physical distancing cannot be maintained? And maybe also talk a little bit about what a mask break would look like for some of our younger students.
Sure. And I think it's really important also to answer the question at the same time. I'll answer those as well as who should wear non-medical masks in school. So let's start with what we know. The Ministry of Education requires students in grades 4 to 12 to wear a non-medical or cloth mask while indoors on school property. They encourage students in K to 3 to wear masks in indoor spaces, but reasonable exemptions on the requirement to wear masks will apply. So local school boards, such as Halton Catholic District School Board, must follow these minimum requirements, but each board has the decision-making authority to exceed those minimum provincial requirements. At this time, Halton Catholic District School Board requires all students JK to grade 12 to wear non-medical masks. Local public health units like Halton Region Public Health does not determine masking policies in school, but we provide recommendations and information to our school boards to inform the school board's decision making. So in terms of evidence on the use of masks in non-clinical settings, this is still emerging. Current evidence indicates that wearing a mask is likely helpful for keeping the wearer's respiratory droplets inside the mask, but it will not protect the wearer from respiratory droplets of others unless they too are also wearing masks, because these non-medical masks don't filter droplets coming in. So it's important to understand what the mask will and will not protect. And again, as I mentioned, the evidence is still emerging on this whole area. What we have seen, though, is that there's evidence that in places where wide-scale mask use is prominent, that they have been able to reduce their overall COVID-19 case rates. Overall, masks are safe to use, even among children. In terms of risks, continuous mask use may be associated with certain facial things like skin lesions, rashes, and acne in some people. And certainly in younger age groups, there is the potential risk related to language and social development. In addition, self-contamination can happen if individuals touch or move their masks with their dirty hands, and therefore it's really important to incorporate good hand hygiene with mask use. Halton Region Public Health is supporting the development of age-appropriate mask education, as I mentioned, for students, and will continue to support school administration in preparing for reopening in a setting where many students will be wearing masks. We understand that wearing a mask correctly for the full school day may be difficult for students, and that's why we're also suggesting that we have these mask breaks. And what that could look like is it could include during recess time, as long as there is appropriate physical distancing in the outdoor space, that the child may remove their mask again using good hand hygiene, be able to do that in that space. It could include in the classroom space, as long as there is appropriate physical distancing for children to take off their masks for a short period of time to get that mask break. So it could be a variety of things, and it will be up to the school board and each of the schools to figure that out. Hopefully that helps answer the question, Pat.
That does. Thanks very much. Our second question, if a child is experiencing just one symptom, are they required to stay home?
Yeah. So the Ministry of Education requires all staff and students with the support of parents to self-screen every day before attending school. And if a student or staff member is experiencing any one symptom of COVID-19, they must stay home from school and should seek medical assessment. Right now, we are still waiting for that guidance document from the Ministry of Health to be put out, and we're being told it is coming very, very soon. And that should also clarify this issue of the symptoms. In the meantime, to familiarize yourself, you can also look at the Ontario self-assessment tool available at ontario.ca/coronavirus, or you can call telehealth. If the symptom is related to an underlying reason, let's say, for instance, seasonal allergies, then the staff member or student will need to follow school board processes to confirm that this is the case. It's important for these individuals to continue to monitor their recurring symptoms and to seek medical assessment should they have new or worsening symptoms. This is the same as the requirements for children attending childcare centers as outlined in our childcare center recommendations, which is also available online.
Thanks for that as well, Dr. Meghani. Another question we've had quite a bit is, will schools take each student's temperature before they come into school? Right.
So the Ministry of Education requires, as I mentioned, all staff and students to have this self-screening in place before attending school. On-site temperature is actually not required. And in fact, on-site temperature taking has not been shown to be effective strategy to screen for COVID-19 in children, as the majority of cases in children did not have a fever during their course of illness. Should a student complain of fever while they're in the school setting, a temperature check is recommended, and it's best to use the least intrusive method. So we are recommending the use of what we call non-contact thermometers. I'm sure that many people have seen these out and about or on television. And we would like to make sure that the person using the thermometer is wearing a medical mask and eye protection when they are taking that temperature.
Okay, so what should teachers and other school staff do if they see a child at school with symptoms?
Yeah. So staff, again, are to monitor themselves and students for signs and symptoms during school operating hours. Staff should be provided with, and they will be provided with information on signs and symptoms of COVID-19 in their students. Students are encouraged to alert their teacher as soon as they do not feel well. A student with signs or symptoms of COVID-19 should be immediately separated from others and supervised in a designated room or space. So your school board has a plan for that. Their parent or guardian should be contacted to pick them up immediately. The student should not be taking school or public transit at that point in time. The school protocol should include procedures for picking up students with signs and symptoms of COVID-19, including their household siblings. And the student should seek medical assessment promptly. Any staff or essential visitors with signs or symptoms of COVID-19 must go home immediately as well. And if they cannot return home immediately, again, they need to be isolated in a designated room or space until their departure. Any staff or essential visitors with signs or symptoms of COVID-19 should also avoid using public transportation if possible. A kit should be made available for use by the ill individual and the staff member attending to them. So the kit will contain a few things. It'll contain alcohol-based hand rub, gloves, medical masks, eye protection, and a gown. Instructions on the proper use of this personal protective equipment should be available on the outside of the kit. And a non-contact thermometer should also be available, and a temperature check is recommended if the ill individual is complaining of fever. The thermometer must be covered by a single-use protective cover or cleaned and disinfected between uses. Staff and children who were exposed to the ill individual must continue to be grouped together and monitored for symptoms of illness until the ill student receives their COVID-19 test result. If an individual tests positive for COVID-19, public health will notify the individual and the school administration, and public health will work closely with the school to identify close contacts and inform parents. I want to remind everyone that we've done this many times, even before COVID-19. We have dealt with other communicable diseases, such as pertussis, and so we know how to ensure that staff and students are well supported and that families are well communicated with should we have even a single case of COVID-19.
Thanks for that response, Dr. Meghani. And just so our families who are tuning in tonight know, before we close tonight, we're going to review some of the measures that we have put in place in our schools based on a number of those recommendations. Our last two questions, you really did cover them in the presentation, but it's something that parents and staff have come back to us a number of times to ask about. So the first one is, what will happen if there are positive COVID-19 cases in a particular school?
Yeah, so I'd love to give you a simple, straightforward answer, but I can't. That's because every case results in a detailed history taking, detailed contact tracing, and risk assessment by our public health nurses. Each situation is going to be unique, and Halton Region Public Health will work closely with the schools to determine who those close contacts are and what the exclusion and isolation requirements for those close contacts and other individuals from the same cohort will be. At the same time, we need to maintain confidentiality of the confirmed case, and we will do that to the greatest extent possible. The decision to shut down a classroom or a school will depend on what we find as we're investigating or assessing the situation. So we look at, what's the likelihood that the confirmed case got the infection at the school, or their presence and activities at the school during the time where they may have been able to transmit disease to others. So including the time that they're symptomatic and the 2 days prior to symptoms developing. And we'll work with the schools to provide appropriate communication to everyone involved. The Ministries of Health and Education are currently developing outbreak management protocols for schools, which, as I mentioned, will be shared with Halton Region Public Health, and we'll share it with our school board partners as soon as it's finalized.
Okay, thank you. And my last question, I'm going to ask on behalf of our parents, but I'm also going to ask as a parent. If one of my children tests positive for COVID-19, do my other children have to stay home from school and self-isolate as well?
So the answer is yes, and let me explain why. So there's a couple of things. First, as we know, COVID-19 transmits when there's close contact. So obviously in your household setting, there will be close contact. It is very difficult to maintain, non-close contact for the entire school year. Secondly, in May of 2020, I issued a class order under Section 22 of the Health Protection and Promotion Act. So this is a very important piece of legislation that protects Ontarians' health and safety. The class order legally requires that all Halton residents self-isolate if they have been diagnosed with COVID-19, have COVID-19-like symptoms, are awaiting their test results and have symptoms, or are close contact of an individual who is a confirmed case of COVID-19 or someone who has symptoms of COVID-19. So that covers the household in essence. Under the class order, all close contacts of the person who tests positive, including all household members, must self-isolate at home for a 14-day period from the last time that they were exposed to the individual. Close contacts are required to self-isolate for 14 days from the last known exposure, as I mentioned. And this will look a little bit different from family to family. As I'm sure as a parent, I can say it is very difficult to self-isolate from one's own child while there are symptoms. So you may be at home for a little bit longer than 14 days, and we'll walk you through that if it's necessary. In addition, if a person has symptoms and is awaiting test results, the individual with the symptoms and all of their close contacts, including all household members, must self-isolate at the same time. So we've got information about how to self-isolate. It is available on halton.ca/COVID-19, and all you have to do is scroll down to the COVID-19 health advice and look under the self-isolation tab. This information is provincial, and it's very easy to read and understand. There's some pictures involved as well, and we always provide this information to those that we are asking to self-isolate.
Thanks very much for that, Dr. Meghani. And again, on behalf of all of our families here in Halton Catholic, all of our staff members, we really do appreciate you giving up some time tonight to help us out with some further information. And certainly thank you and your team for all of the recommendations and support you've provided for us. I did say before we close tonight that we wanted to review some of the measures that we've put in place for our schools in September. So I'm going to call on two of our superintendents, Superintendent Ballo and Superintendent Merrick, to walk us through some of those measures that we have put in place to ensure a safe re-entry back to school. I'll turn it over to you, Superintendent Ballo.
Dr. Meghani, for the presentation this evening and for your ongoing partnership. We can always count on you. In the following slides, we will be speaking to the multiple measures in place in our schools to help prevent the spread of COVID-19. Health and safety training is a very important measure. Staff will be provided with a full day of health and safety training prior to the start of the school year. This will include training on COVID-19 awareness, screening, signs, symptoms, taking it off, and other safety protocols related to the return to school. Topics such as masks and face coverings and safety protocols will be self-assessment is guardians must perform daily screening of children for
Superintendent Ballo, we're losing your connection a little bit, so it's been difficult to hear you. Maybe I'll walk us through the next couple of slides. So as mentioned, parents and guardians must perform daily screening of their children before leaving for school using the COVID-19 self-assessment checklist. It's really important for students or staff to remember that if they show signs or symptoms, they need to stay at home, they need to self-isolate, they need to get tested for COVID-19, and to stay home from school until those test results are received. And an individual test positive for COVID-19, as Dr. Meghani mentioned, Halton Region Public Health will notify the individual and also notify the school. Maybe Stephanie, I'll turn it back to you to see if your connection's a little bit better. We're on symptom protocol.
Sure. Can you hear me right now?
Yes.
Okay, so symptom protocol. Students or staff who show signs and symptoms of COVID-19 during the start of the school or workday must go home immediately, and Dr. Meghani has also spoken to this. If they cannot return home immediately, then they must be isolated in a designated room or space until their departure, and that designated room will be defined by the school, and it will be identified and prepared. In the event of a confirmed case of COVID-19, Halton Region Public Health will notify the school and provide further information on contact tracing and outbreak management. A confirmed positive case must have clearance from public health before returning to school. And I would add, it's really important that families maintain their emergency contact information with the school. Hand hygiene, education, and routines will be explicitly taught and reinforced regularly. Hand hygiene stations will be set up throughout the school and in all classrooms. Proper and frequent hand hygiene practices by staff and students will be encouraged. Soap and water for at least 20 seconds at regular time intervals throughout the day, especially before eating food and after using the washroom, and before and after outdoor play. Masks. Medical masks will be provided for teachers and all other school staff. All HCDSB students from kindergarten to grade 12 are required to wear non-medical masks, face coverings at school. Reasonable exceptions to the above requirements apply. We are working with Halton Region Public Health to provide age-appropriate mask education and information for families. Exemptions from wearing masks for students. Reasonable exceptions to mask wearing will be considered. An exemption may be requested for a student from kindergarten to grade 12 for the following reasons: a pre-existing medical condition, a diagnosis or learning profile that would limit a student's ability to tolerate or safely wear a mask, including whereby a mask would affect essential communication for a person who is hearing impaired, and anything else that's detailed by a healthcare practitioner. A process for the exemption approval will follow and will be communicated with families.
So I'll take over from here. So we will have a detailed strategies to promote physical distancing throughout our schools. First and foremost, increasing the physical distancing between chairs, desks, tables, and other furniture throughout the school in both classrooms and in common spaces. School staff will be encouraged to have classes outside as much as possible. School administration will be looking at staggering lunches and recess times, as well as movement throughout the schools to discourage congregating and promote physical distancing throughout the school. And of course, in our classrooms, student desks will be arranged to provide as much distancing as possible between students within that classroom. And we have a few photos coming up on the next couple of slides here. So here you see two pictures. The top photo has a classroom, an elementary school classroom with 20 desks. And you can see the desks are all facing the same direction, spaced equidistantly throughout the room to provide as much physical distancing between students and the teacher as possible in the classroom. And the lower photo has 30 desks, again, a little bit tighter, but again, providing the most amount of distance between those desks as possible and between the students as possible. And both these photos here are from an elementary school. And next up, we have a secondary school. So a little different setup in the secondary schools. You can see there's two desks side by side, but still arranged in a similar fashion, facing the front and with single file rows. Of course, in secondary schools, we will have two different cohorts of students attending. So you have a cohort A and a cohort B of students attending on different days. So the intent here is when you see each of those pairs of desks, one would be a cohort A student and the other would be a cohort B student that would not be there on the same day. So by doing this method here, we reduce the number of aisles in the classroom and actually create further distancing between the students that will be in attendance on the same day. So the entire intent here, both the elementary and for the secondary classroom setup, is to provide as much distance as possible between the students. We'll also be employing many strategies to minimize contact between students and staff throughout the buildings. Each school will have a detailed drop-off and pickup protocol that will be set up by school administration. We will have restrictions on visitors in our schools, whereby visitors are only permitted to access by a scheduled appointment. Each school will have processes for safe entry and exit of the school building. Students will be cohorted both at elementary and at secondary schools to minimize the number of contacts that they have throughout the school. Water fountains will not be accessible in any of our schools to reduce the number of touch points that students may have in that building. However, we do have water bottle fillers present at all of our schools, and the bottle fillers will be accessible and cleaned on a regular basis to allow students to fill up their water bottles that they'll bring to school each day. And we also have many physical barriers that we've set up throughout the building as well. So these are the plexiglass barriers to promote or provide a barrier between staff and students in a number of areas where they may come in within 2 meters of each other. With respect to ventilation, Halton Catholic, we are very blessed to have a great fleet of schools. We actually have the second youngest fleet of buildings in the province. And with that comes great mechanical systems in our buildings. So all of our classrooms, including portables, have mechanical ventilation set up in those classrooms that provide fresh air into our buildings. Even though COVID-19 is not an airborne disease, we do want to try and provide the most amount of fresh air that we can in all of our classroom spaces. And my team's been at work this summer rearranging and reprogramming our mechanical systems to maximize the amount of fresh air that we're bringing into classrooms and to improve the number of air changes that we have in each of our classrooms. In addition to the mechanical ventilation that we have in our classrooms, staff may opt to open up windows for additional natural ventilation, although not required since we do have the mechanical systems bringing in outside fresh air. And of course, HCDSB staff will keep up with our regular inspections and preventative maintenance on our HVAC components to ensure they are all in good working order. And for this year, we will not be allowing the use of mobile fans and space heaters that can create local currents in the classrooms. So we've removed many of those, and we'll be relying on our central mechanical systems to provide ventilation in our classrooms and portables. We also have enhanced cleaning and disinfection protocols now in place. All high touch points areas throughout the schools will be disinfected twice daily or when visibly dirty. We will have disinfectant wipes and disinfectant spray provided in all classrooms to allow us to disinfect high touch items throughout the classroom during the day. Staff rooms will be cleaned in the evenings and with disinfectant wipes and disinfectant spray provided for intraday disinfection as required. In gymnasiums that may be used by different cohorts will be disinfected in between different cohorts using that space. Although we will encourage outdoor gym class whenever possible as weather permits. And lastly, we will have a number of new signs posted throughout our schools to remind folks about the COVID-19 protocols, so things like screening information, visitor protocol, hand hygiene, physical distancing reminders, many new signs that I'm sure you've seen throughout our community will be posted in our schools as well to remind folks of the new procedures to cope and deal with COVID-19. We will have designated routes for students and staff to get to and from classrooms that'll promote physical distancing and avoid or reduce the likelihood of folks congregating in our hallways. And we also have markings on floors, floor decals, wall signs to remind folks about physical distancing and include procedures for queuing and lining up, such as tape on the floors or signs on the walls. Many new signs throughout our schools to remind folks about the new reality that we are in with COVID-19. And then lastly, I'll just remind folks that we do have an intent to return to school parent survey out right now. The survey closes tomorrow, Wednesday, August 26th at 11 p.m. So please complete that survey because we do very much want your feedback and your decision. So please follow the links in the emails that you have and complete that survey by tomorrow at 11 p.m.
Thanks very much, Superintendent Merrick and Superintendent Ballo for walking us through some of the measures that we'll have in place for our return to school in September. I hope that was helpful to our parents. It is a difficult decision for you. I know you have many questions. We're very hopeful that some of those questions were answered tonight. I'd really like to thank Dr. Meghani again for spending time with us this evening to explain what our students can anticipate coming back in September, and for all of the help she's provided for us over the last several months as we plan our return to school. For the parents that have been watching tonight and staff, we'll send a link out to you tomorrow to tonight's presentation so you can take a look at it again if there's anything that you want to review one more time. Once again, we thank you very much for all of the questions that you've sent to us. We are really looking forward to seeing your sons and daughters either physically back in school or virtually back in school. And please know that on behalf of all of our staff and our trustees, we hold all of you in our thoughts and prayers, and we are very much looking forward to the beginning of the school year. Thanks very much for joining us tonight, and have a good evening.